Dear students, we'll discuss a case scenario which is very commonly seen in OP or ward surgical practice, very commonly discussed and commonly kept as a long case in the exam, as a oxy spotter is kept, even sometimes short case also. And theory, it may be a long question, short note also. A lot of MCQs will be asked. So this similar topic I have discussed in earlier lectures also. You can always go through those lectures for further understanding. This is a little different part, but with the different explanations probably. So you can club both, go through that so that you can have the idea. So what this condition is, so look at that. You can see that grade 2 is black, dry, and there is a line of demarcation. Line of demarcation, separation from the normal tissue. Live tissue, dead tissue separation. And you can see the small bone part here. Edema is there in the foot. Brittleness in the nail of the other toe, that is also important. So it's nothing but ischemia with the gangrene. Probably dry gangrene. Know that dry gangrene is there, wet gangrene is there. You have to know the definition of the gangrene. It is macroscopic depth of the tissue. In situ word is important with the putrefaction. So line of demarcation, if it is dry gangrene, it is the aseptic inflammation. So clear line of demarcation, whereas so that mummified gangrenous area, dry black area is clearly seen. Whereas in wet gangrene, it is unclear line of demarcation, it's a septic separation. So aseptic separation, dry gangrene, septic separation, wet gangrene, where it's progressive. Wet gangrene is dangerous, may progress proximally. And additionally, other area also you have to examine, and you have to examine the peripheral pulse always is important. Always examine the peripheral pulse from below upward. Dorsalis pedis, posterior tibial, popliteal, femoral, radial, ulnar, brachial, axillary if possible, subclavian, carotid, superficial temporal artery, right, left. Always write in a tabular form, always from below upward, never write haphazardly, in an orderly fashion. And you should know how to examine this one. You should be able to demonstrate in a clinical exam, how to demonstrate dorsal pedis artery examination like that. And so all these things should we have a very clear idea. So you can always go through my clinical methods in surgery, which gives a very clear idea, examine the arterial system with the video there, how to examine arterial system, how to examine different pulses, how to examine, always examine opposite side, look for wasting, look for signs of ischemia, wasting, thin skin, hair loss, brittle nail, pre-gangrene area, edema, veins are altered. So all those things, of course, with the pulsation. Systemic examination important, abdominal examination important, artery pulsation, trill over the artery, Bruy auscultation over the artery, cardiac system examination important. So other respiratory system examination important, all other system examinations also important. It's a big examination system actually, and we had a live session about that earlier. You can always go through that, peripheral arterial disease, and also we had a small lectures also along with that, which has given an entire scenario of the peripheral arterial disease, how to examine, which is a long case for you people, and many short notes, classification, Boyd's classification of claudication, rest pain, what is the meaning, different classifications, everything is given in manual of surgery, arterial system and clinical method in surgery, how to examine these things are detailed properly. You have to go through these things in detail, my book, these chapters for further understanding and clear knowledge. It's important, clear-cut knowledge and clear-cut approach to this peripheral arterial disease is very important as a clinician and as exam students, either NEET, MCQs or clinical exam, oxy, or for PGs also it is very important. To manage a patient also it is important. So already I have told what is the gangrene, everything. Line of demarcation I have told. There is a band of hyperemia, that is important. It's of MCQ question. Now this separation, this is again aseptic ulceration in a dry gangrene, septic ulceration, septic separation in the wet gangrene. So this is again MCQ question, remember. Septic ulceration, aseptic ulceration. In wet gangrene septic, in dry gangrene aseptic. And so Fontaine classification of limb ischemia, stage 1, 2, 3, 4. Again many times MCQ is asked. Stage 2 Fontaine classification is what? 2A, 2B what? So you should be able to answer that. Again, Rutherford classification, stage 4. Suppose ischemic rest pain is in Rutherford classification is stage 1, stage what type? Then you got a choice 2, 3, 4, 5 like that. So it is stage 4. So you should memorize these things so that you'll be able to answer the MCQ. Again, same thing you can memorize so that you can correlate and answer MCQ question, because important for MCQ actually. So it can be functional limb ischemia, which is compensated. When there is arterial block there will be collaterals will open. So distal vessel perfusion occurs, they call distal runoff, which is identified by angiogram. So that ischemia has occurred, which is compensated through collaterals. That is called functional limb. Limb is functioning. Functional limb ischemia, otherwise called as compensatory peripheral vascular disease. And because now once disease progresses by smoking, continuous smoking or disease as such, collaterals also get diseased, and no more collaterals, adequate collaterals are opening and functioning to maintain the adequate distal runoff and compensate the blockage and compensate the ischemia. Then becomes a decompensated peripheral vascular disease with what is called as critical limb ischemia. You have to know the definition of critical limb ischemia. Please go through my book, Manual of Surgery, and also Clinical Method of Surgery, specific chapters. It will give you a clear idea about that. So remember these things. Boyd's grading, Leriche syndrome, pain in the buttock, iliac block, and impotency. It's a very common MCQ question. Rest pain, critical limb ischemia definition, causes of ischemia. What are major artery, small artery vessel, different causes, atherosclerosis, TAO, so many conditions are there. Remember, palpation ability from below upward, already told. Evaluation, technique is important. How we will evaluate arterial Doppler, angio conventional and CT dynamic angiogram, quasicroaperium, collateral, distal runoff, and levels of block, segments of block. There are different classifications are there for that. That also you have to check. Of course, management, drugs, surgical approach, indirect surgeries, direct surgeries, profundoplasty, grafts, saphenous vein graft, saphenous vein in situ or reversal of the graft, and arterial substitutes grafts like woven graft or Dacron grafts, woven or knitted, PTFE, polytetrafluoroethylene graft. So different things you have to know. So detailed arterial chapter you have to read in my Manual of Surgery, and arterial system examination you have to read in my Clinical Method in Surgery, where how to examine the system is video is there. So go through those chapters in specific for further reading about this chapter. But it's very, very important topic in the exam to understand a subject for MCQs, for VOXI, for Viva. So for students it's very important. So this again and again is discussed earlier as a live session also in exams of vascular disease. And so many small lectures also put forward. Please go through those things also. Meantime, I request all the students and viewers to subscribe my channel, and also please request your friends and colleagues to subscribe my channel. It's a free and daily few short topic lectures are there with the MCQs and quotations, which will very helpful to understand surgery topic, to learn and face surgery exam, face surgery patients as such in future. So answer the MCQ. Please answer the MCQ, put it in the comment box. I will acknowledge your answers, give a proper explanation. So in Bhat's classification and classification, grade 3 is A, B, C, D. Please go through this, put a right answer and seek explanation from me. I will acknowledge you. Again, same thing, another question, same again MCQ question which is commonly asked. In angiosome concept, total number of angiosomes in body are 10, 20, 30, 40. Put the correct answer. And quotation of the day, important, you are waiting for this quotation. Most important factor in survival is adaptability, not strength nor intelligence. You should learn how to adapt in your life, how to adapt in your career, and in specific, how to adapt in surgical profession, in how to adapt to individual case surgeries. So adaptability is the most important thing for your life, for your profession, and in specific for surgery. So students, please go through my SR-based clinical methods in surgery, current edition, which gives in detail about the clinical exams, all chapters including X-rays, other images, basic instruments, specimens, and gives a very lot of photographs are there, figures, illustrations are there for your benefit. Detailed clinical methods and case sheet rating is there. That's very important for clinical surgery. And manual of surgery, current edition gives a detailed discussion of all topics, specialties, urology, cardiothoracic, and other chapters, including instruments, operative surgery specimens, as per CBMA syllabus in detail for your knowledge, exam, theory, clinicals, everything. Please go through that. And of course, my operative surgery book in the 2 volumes, very useful to understand the very operative procedures with the step-by-step technique. And my atlas of tissue approximation, small book with a video. All this contains a video of the demonstrations of different things. It also gives a suturing technique very briefly, very nicely, and with the principles. Please kindly go through that. And my SRB surgery insights and YouTube different channels. My website. You can please subscribe. That will be a lot of information, and it will be very well benefit for all students. And please subscribe my SRB surgery insights of different modalities for understanding better knowledges and subjects, because best topic, different versions are there in small topics in the website. And this is the QR code for the same. So students, I hope you understood this peripheral artery disease with the gangrene, dry gangrene with the line of demarcation very well. Please go through my manual of surgery, go through my clinical method of surgery, these topics, and also subscribe my website, so that we have a further understanding, further going through of surgical different surgical topics. So students, thank you so much.